Interesting topic. This topic actually, last week I met one doctor, and she said that, in fact, she was very much, hesitant to. Interesting topic. This topic actually, last week she was very much hesitant to tell me about this. She said that her materials are getting lost from the general practice clinic. She ordered so much medicine of routine injection, even the tetanus toxoid injection. And what is happening is within 3 weeks, whole stock gets over, and then she has to order. So I just, it was totally informal discussion. I talked with her, and then from the information what she gave me, I told her this particular employee looks suspicious to me, and you have a watch on her. She immediately said, "Doctor, that is my 10-year-old employee. That is my 10-year-old employee. So I don't suspect her." I said, "Whatever is there, you are saying that is all right, but pay attention to her." And immediately, within 3 days, she caught her only. So she was the culprit. So now, let us see how doctors are getting cheated in their medical profession. Okay. Here we are restricting to our medical profession that how doctors are getting cheated. There are various people who are coming in our life, in our practice, okay, and they take advantage of either your good nature or they take advantage of your busy nature, or they take advantage of third element, that is of your ignorance. And fourth one is your trustworthy nature. You are trusting anybody and everybody. So these are the mainly 4 factors. So now let us see which particular category of people can cheat you. Okay, so we'll go one by one. Are you ready? Everybody ready? Great. Now, first and foremost is your receptionist. Okay.
Right.
By receptionist. Now, what happens? How receptionist cheats you? There is a typical way, everybody, it has got very typical way of carrying out this particular cheating business with you. And that's what we are going to see. Now, what happens? Usually the cheating is related to your money. Is related to your money matters. So how? The receptionist. Okay, now we are concentrating on receptionist. Okay. What does receptionist do? Receptionist will take extra charges from the patient on your behalf. They will take extra charges from patient on your behalf, and they will keep that extra money with them. They will not give it to you. Suppose, example I will tell you, suppose your charges, whatever has happened, you told receptionist that, okay, my dear, you collect 150 rupees from this patient. The receptionist goes outside and she tells 200 rupees to the patient or the relative, and patient pays 200. Now, when the patient pays 200, what happens is they give you 150 only. The receptionist hands over 150 as you requested, but that she has taken 200. Now, you never come to know unless and until that patient complains to you next time or sometime in his life that I have paid 200, doctor. So that is one kind of cheating only. So you got this clinical practical condition. Here the talk is always practical. No bookish knowledge, no MBA book index. This is practical, doctor to doctor. No management MBA involved in this. Second thing is what? They will take the money from the patient, but they will not give it to the doctor. Okay. And because of your busy nature, you forget. You forget that whether that particular patient has paid or no. And because it so happens, it's a very common situation that it's night now, 11:30, you want to close the clinic, and you think that, maybe chalo, take it tomorrow, we will see. Then you forget. So taking money but not giving to doctor, this is the second point. Third thing is interesting. They will take less money from the patient. Here, the receptionist, the outside staff will take less money from the patient. Why? She will give her discount on your behalf so that she develops good relationship with the patient or the patient's relative, and then she can go to home and give home treatment, home injections, or she can get the order of visiting home for dressing. So they want to develop good relation with the patient and the relative. So they take discounted money from the patient. Second interesting thing is this particular what incidents I am going to tell you has really happened long time ago, almost 12 years ago, when I was sitting in one big polyclinic. And this is usually happens in a big polyclinic only. What is the situation? There are 4 or 5 consulting rooms. Okay. In one, say Dr. Vinod is sitting in one room, Dr. Sanjay is sitting in second room, and in third room, Dr. Anil is sitting. Now what happens, a receptionist comes in Dr. Vinod's chamber and says, Dr. Sanjay, he has requested you to give loose money, chutta chahiye, change chahiye, 100 rupees ka change chahiye. He wants 50 rupees 2 notes. So you wonder, and you are also busy, everybody is busy, it's a polyclinic, so you give her 50 rupees 2 notes. Now this receptionist goes to Dr. Anil's room and says, Dr. Sanjay is asking for a chutta of 100 rupees, 50, he will give you later on, he has to give it to patient. So Dr. Anil also gives 50 rupees. And then she goes to Dr. Sanjay's room and says, Dr. Anil is asking for 100 rupees change. So do you have? Then you give. Okay. Now, say everybody is sitting between 5 to 7. Now at 7 o'clock, 7:30, your consultation line is over. You come out. And then when you meet Dr. Vinod, Dr. Anil says, Dr. Vinod, you are not having change today? The matter is small, no 100 rupees. So I don't ask only. So I just say, you are not having change today. So I had given change to you. He says, what? I had given change to Dr. Sanjay. Where is Dr. Sanjay? Dr. Sanjay says, Dr. Sanjay, you had given, I had given change to you, Dr. Ravi. So everybody has been cheated for 100 rupees. And that receptionist is not the regular receptionist. She was a cheater only. She just came here, knocked your consulting chamber and asked for change of 100 rupees for other doctor. She was a cheater. She is not at all a regular receptionist. See, the polyclinic, there are so many staff. You don't know only who is which receptionist. So this is straightforward cheating and smooth cheating. Okay, and this has happened. That's why I'm telling. Second thing is they do false demand on your behalf. This happens especially in hospital when you leave, or the receptionist is smart. She understands that doctor has done dressing also, doctor has given injection TT also, doctor has done consultation also. Now she knows you have paid the consultation fee. Now she makes extra demand from patient. Dressing का 50 रुपया देना है. She goes to the patient that a relative and says, doctor has asked 50 rupees for the dressing which was done. And she collects, pockets that 50 rupees. You will never come to know that you never ask, so you don't know that you have to collect that. That is not in your calculation. But what happens, the sister has already collected 50 rupees from you. On your behalf, she has collected 50 rupees and that she has pocketed. So this is how receptionists can cheat you on various occasions. Now say we'll come to the second category, that is the hospital staff. How various hospital staffs are there. How they can cheat you. They will straight away come and ask for the money, that I have to go for vacation, गाँव में जाने का है, पैसा ऐसा हुआ है, and give me 500 rupees. The amount will be not very heavy. It will be between 500 to 1000, and you will immediately give, and that staff doesn't return. Once they go to their village, they never return. And then you are wondering what happened. You also forget, they also forget. Second thing is your items like stethoscope or your pulse oximeter. They have got habit of lifting it and pocketing it, taking to their house. So if you wonder, no, that how the each and every small items are getting vanished. Okay, one doctor told me that his sphygmomanometer, blood pressure, cough was getting misplaced. Okay, so what they do, they take that instrument or the gadgets or injection syringe. In hospital, the urinary catheters, they take it with them. Simple gloves, cotton rolls. Halas, they put it in the purse and go. You are busy, you don't know. Now, have you ever counted how many cotton pads are remaining in your clinic? I have never counted. But when you see in 1 month, they are getting over. Okay. So that is the point when you should take action, and I'll come to that, how to prevent. Second thing is what? They conceal. First, suppose they want to do the theft. They do not take it away immediately. What they do, let us see, they have got, their eyes on your pulse oximeter or spirometer. So what they will do, they will hide it. They will keep it and they will hide it at one particular place. And then they will judge your reaction in next few days. Okay. I will tell you true incident which happened with me. I was sitting in one surgical nursing home. So we have got artificial skin substitute. They are very costly and they come in sterile bottles. Okay. So we have to break it and then we have to use it. Now, next day there was surgery and I kept that bottle in the evening in that hospital. The night duty staff came and went away in the morning next day. So during the operation, that bottle was not found. Nobody knew where it has gone. Then looking at my condition, and the patient was under anesthesia, one staff, she said, she ordered Mausi, just you check it in the bathroom, just, behind some, what do you call that, bathroom cleaning lotion, say Harpic or anything. Behind that, you just check. And when Mausi went there, it was there. Now, how did she know? So I finished my operation and then myself and nursing home owner, we took that sister inside, we counseled her and we asked her that why did you steal it? Then she said, that item is very costly. If I sell it to chemist, he promised me to give 3,500 for that one bottle. Okay. So that's the advantage how they take of your trust. So always this possibility, you must keep it in the mind. Second thing is, especially in surgical nursing homes, what do staff do? They replace your new instrument with old one. I have seen this happening in various orthopedic hospitals. What they do, your new instrument while washing and this and that, when nobody is looking, no, so that time what they do, they replace it with old one and the new one they sell outside. And then you start wondering कि अभी तो लाया था और अभी क्या हो गया instrument, why it is not working or why it got blunt. Okay. So this can be prevented when you write your name on that particular instrumentation, right when you purchase. Okay. So that is called as the replacement. Then they still regularly injection syringes, tetanus injections, antibiotic injections, painkiller injections, sometimes even the narcotics. Okay. Those injections, steroid tablets, they know what is good for their health. तो वो steroid tablet खाली कर देगा आपका. आपने लाया एक हफ्ते में finish. These are the items which you should be, keeping watch on. Especially in our face and laser and hair care center, what happens is the face creams, face wash, they all whatever necessary for external application for face, hair oils, hair creams, and then dandruff paste. You get 100 ml bottle. Next day it becomes 50 ml bottle. Okay. So that sort of behavior from the staff, they remove it and take it home. So that can happen. You have to keep watch on that. Then there are so many people, they collect money from you on various occasions. Okay. Another thing is what I have noticed, important files of important patients. Okay. Especially any medical legal, that goes missing. And that is a very, very serious issue. Because that particular staff might have been benefited commercially by patient's relative. And they go to such an extent that they take out some important papers, take out some important file from your cupboard and then vanish it. This can happen. Once if you are aware, then it will not happen. My job is to make you aware. That's all. Then comes cheating by your accountant manager. Because if it is a busy hospital, then you have separate billing department, isn't it? Now, when there is a separate billing department, that time there is accounting manager. Accounting manager, as he becomes senior, he knows your methodology of working, where you are paying attention, where you are not paying attention, on which topics you are ignorant. He knows. And then he adjusts the accounts. If you have seen 100 patients, he will adjust it to, even if he adjusts it to 98 every day, there is a lot of damage done to your income. Because there is a saying in English that familiarity brings contempt. So when they earn your trust, then they break it. Because unless and until they develop your trust, how can they break it? So that is very important issue. Next, cheating happens by your vendors. Vendors means the people from where you are purchasing your equipments, people from where you are purchasing your medicines, medicaments, ointments, liquids, tablets, or even in the hospital floor cleaners, whatever liquids, solids you need for your clinic or hospital, those vendors, they can cheat you. How they cheat you? Number one point is they can cheat you on their quality. They will show you one quality, they will give you subsidized quality. When you use it, that time you will know. Second thing is quantity. Say you ordered 1,000 pieces of something, they will give you 900 pieces. Tell me one thing, have you ever counted 1, 2, 3, 4, how many has got? You left that job to your receptionist or the staff. And there the trust develops and then distrust happens. So quality they can cheat you, in quantity they can cheat you. Third interesting thing when they cheat you, in while giving the bill. Suppose you have negotiated the rate from 1,000 rupees, you have negotiated to 800. But when the final bill comes, they will put 1,000 only. And you don't know, you don't remember, or whenever the staff brings her, this bill has to be paid. Okay, how much is the amount? You write the check and you give it. So that can happen. There you have to be careful. How much amount was decided and how much amount is there on the bills. Now, especially in laser machines, in plastic surgery, what happens? They promise you one particular brand machine, and the machine is refurbished. Okay, the machine is refurbished machine. Now, refurbished machine means what? Outside it looks brand new, but inside all Juna Purana material hai. It's a second-hand machine, or it may be a third-hand machine. That is, there is a very beautiful term, refurbished machine. In short, they are cheating you by promising you they will give you new machine and they have given you used machine. Okay, that's what is happening. These are the vendors which you should be aware of. Then they will give you the brand itself, another brand. Okay, now here what happens? You were promised one particular brand. Okay, but when actual machine comes in that whole wooden box and you open it, you find it's an entirely different brand, and now the person is not contactable. So this is like cheating. Okay, this you have to keep a watch that what is happening and what should not happen. Price, as I told you, that depending on your practice now, depending on price, what happens, there is no how you are cheated in price. There is a instrument, one instrument you want to purchase. Now, cost of that instrument to Dr. Sanjay will be different. They will quote different. To another doctor, they will quote different, because now they know that another doctor is not able to pay that much, so they will quote less amount to him, and they will quote high amount to you, and they will even show the bills of that particular high amount. They have got separate bill book. If they have quoted you 1.5 lakhs, they will show you the bill of 1.5 lakhs, and they will say, see, there are so many doctors they have purchased for 1.5 lakhs. Now, if they go to another doctor and they think, he may not afford 1.5, I will give for 80,000, then they will show that particular doctor the bills of 80,000. See, this is the bill book, and see, these doctors have been purchased for 80,000, and then you will order for 80,000. Now, what happens? Same machine was given to 80,000 to them, and to you 1.5 lakhs. This is called as cheating. So this is how the vendors will cheat you while you are negotiating or while you are deciding the charges or the machine price. Okay. So they develop your trust. These vendors, they develop your trust. And do you know how they develop your trust? Within 2 seconds. Listen carefully. You might have to see this video again and again, because there are so many important points, and I have concentrated all the experience in this particular video. So if you think you missed something, you should go back and see the video again. Now see, what they will tell you is they want to earn your trust. And the simplest way is they will tell you the secrets about your colleague or your competitor which you don't know. And you will feel, Arey wow, this particular person is nice. He has given me so nice information about other colleague, what other colleague is doing, what other colleague is not doing. He is giving me the information. So you will be happy and you will give the order to that particular person. Now the same person, same vendor will go to another doctor and tell everything about you to him and earn his trust. So whenever any person comes to me and says, this particular doctor has ordered 100 pieces last month for this particular chemical peel. So I know, yes, okay, now the problem issue is going to come. So, that घंटी एक ऐसा आप करो, ऐसा कोई भी कुछ भी बोलता है ना, तो यहाँ पे घंटी बजना चाहिए, रेड सायरन, रेड घंटी, टिंग टिंग, ओके ओके, नाउ रेड घंटी बज गई, so that you are aware that now this person is going to cheat me. Okay. Now, the another cheating happens by the quack doctors. Okay. So the quack doctors sometimes they promise other doctors so many things that I will teach you this thing. This is especially true in the cosmetology field, laser field. The person is just Chachi 420 or Munna Bhai MBBS. And they start teaching doctors about lasers, about cosmetology, and even the MD doctors, MBBS doctor, MS doctor, they fall prey to them because they are giving it at low cost. They are giving the whole education at just 100 rupees, 200 rupees. So immediately the other people go. But at the end, after some time, they will realize their mistake. Then there are various other three categories of cheaters in the medical profession, or these are the people who will cheat doctors. But we will not go in detail about that. But I will mention their names. Number one is award giving organization. भारत श्री अवार्ड, भारत श्री अवार्ड आपको हम लोग देंगे, आपको जस्ट 25,000 देना है एंड सो सेलिब्रिटी विल कम एंड आपका सत्कार होगा, यू विल बी felicitated by so and so person, just 25,000. Some name they will give to the award. This is the scam, okay, award giving organization. Next, there are camp conducting organizations. As you are aware, recently there were some vaccination camps which were conducted by many people and few doctors, they got cheated. Then there are certain loan giving organizations and cyber fraudster, but that is entirely different topic by itself. Now we will come to the main topic, how you get cheated by patients, right? How patients are cheating you. That is very interesting. Patient will tell you, they will negotiate your charges with you, they will bargain with you. Now, see now, bargaining, we are having one beautiful course of 5 days. It will start from 31st October till 4th October, 31st October to 4th November, okay? And between 4:30 p.m. to 5:30 p.m. on Zoom it will start. What I will do, I will give you the link to that in the chat box. I will send the link and you can register yourself for that particular course, okay? This course will give you full idea about how people are, patients are bargaining with you, okay? And what you can do, how you should talk with the patient so that you get your deserved charges. Many a time patient, they use pressure or they use request. They promise you so many things, but they don't pay in the end. Or they make such a kind of discount that it is almost a full discount. Okay, so you will learn how to handle bargaining patient without getting frustrated, without getting angry. It's a wonderful 5-day course online. Okay, and that thing you will come to know. Thank you, sir. Please, you are always welcome every day, Dr. Vinod. Thank you. Okay, now what happens? Yeah, patient says, what patient will tell you that yes, I am going to pay you. Patient says, I am going to pay you. But what happens? In the end, patient doesn't pay. Okay? In the end, the patient will not pay you. So that is almost amounts to cheating. Now, second type of cheating patients are what? They don't show you the file, previous treatment file, they do not show you. Whatever treatment they have taken, they will not show. Suppose their diabetes report has come very high, they will not show you unless and until you do the diabetic test. You will never come to know that the patient has got uncontrolled blood sugar or uncontrolled blood pressure. They will not tell you the abdomen ultrasound was done or what was the finding. So you have to be very, take the history examination with eyes, ear open. They will not reveal any damn thing because the insurance will not pay. Because the moment you detect diabetes, then their insurance will refuse the claim. So they will not tell, no, I don't have diabetes. And when you do the test, then you will say, what is this? They say, aisa ho gaya. Then ultimately you are the responsible person for all whatever patient has said. Patient is not responsible. Doctor is responsible. Doctor was supposed to elicit all the signs and symptoms. The court will say doctor failed to elicit diabetes and you are responsible. Patient will go scot-free. So that's what the patient will do. Then what happens? The patient asks for money. Okay? The patient asks for money at the end of the treatment or during hospital stay. And then the patient disappears. That is called as giving loan to the patient and the patient disappears. So that is the form of cheating. So patient definitely, I always say that keep your fingers crossed. Do not trust anyone immediately. Now let us see how you can tackle all these problems. Best thing is, number one, remember one thing. Okay, see, in the film there was a movie, English movie, X-Files. How many of you have seen X-Files? There was that Mulder was a FBI agent. So his boss says, trust no one, Mr. Mulder. Okay, what you should do? Do not trust anyone. That is the first thing you should learn. The lesson is, don't trust anybody blindly. Okay, trust, but don't trust blindly. Second thing is, in your center, have CCTV. Nowadays, it is very easily available, and hardly it takes about, I think, recently I put for 3,200 only. Okay, and with Wi-Fi, it can be connected. And there are CCTV with audio also. Means you can hear the audio of what is going on in the clinic. That facility is also there. So put CCTV, and that is the best thing. Video surveillance. Second thing is, allow limited visitors in your clinic. Allow limited visitors in your clinic, limited amount of relatives, and fix the visiting hours. Conduct random checks. Don't decide 5th of every month or Wednesday, 4th Wednesday, we will do the checking. No, any day. Keep it random. Go to the clinic. Yes, today we are going to do stock checking. Then open one drawer. What is there and what has been written? What is the last month count? Last month count was 10 and now there is 1. I have not used 8. Then where they have gone? That's how. Second thing is train all the employees in all the department. Means don't keep your accountant, only one person is accountant and he only does the billing. No, everybody should be trained. Your injections, many a time what happens, general practitioner give one particular person. You prepare injections and break it and make it in a syringe, so that doctor comes, lift the syringe and gives injection. No problem. But okay, in this month you will do, in second month another person will do. So train all. Then another advantage is what, if that particular injection giving staff goes on vacation, then you don't feel exhausted. There is another person ready who also knows how to prepare the trolley and injections and dressing. So that is the advantage. Okay. Whenever you are keeping staff, that time always run the background check on this staff. Ask from where they have come. Suppose that doctor is known to you, then just ask. Sometimes what happens, they have done some mischief in the other hospital or the other clinic and they have left and then they have come to you. So better ask. Even if you are not having good relation with that doctor, still then you phone and ask, so that you are at peace. Tomorrow you will not come across with any problem. Right? Yes. So now what, you can start your video and you can unmute yourself and you can ask your doubts. Dr. Sanjay? Yes.
Sir, sir, am I audible?
Yes.
सर माझे दोन एक्सपिरियन्स सांगतो मी. एकदा एक फिमेल पेशंट आली माझ्याकडे, तर तिची फी झाली 200 रुपीज. तर तिने मला 500 ची नोट दिली, मग तिला मी 300 रुपीज वापस दिले. थोड्या वेळानं येऊन ती बाई मला काय म्हणते, मी तुम्हाला चुकून 500च्या 2 नोटा दिल्यात. आणि त्या दिवशी लकीली एकाच पेशंटनं 500ची नोट दिली होती. तिला मी ड्रायव्हर मध्ये दाखवलं, म्हणलं बघ 500ची एकच नोट आहे. ऐकत ना तरी थोड्या वेळाने निघून गेले. अजून एक दुसरी एक केस, हे ऑनलाईन चिटिंग कसं करतात ते. इथं एका पेशंटची अशी 250 रुपीज फीस झाली. ती मला म्हणाली की ऑनलाईन करते मी. मला हरकत नाही. मग तिने काय केलं, त्या रिलेटिव्हला कोणाला तरी फोन करून ऑनलाईन पे करायला सांगितलं.
ओके.
मग त्याने काय मला ऑनलाईन 1000 रुपीज पे केले. आणि मला म्हणे की आपका फीस 250 हो गया, 750 मुझे वापस दे दो. तर मला थोडंसं जरा फिशी वाटलं जरा हे. म्हणजे मी काय केलं, समोर मेडिकल स्टोअरवाला समोर आहे, त्याला समोर बोलवलं, त्याला सांगितलं असं असं आहे, 250 रुपीज फीस झाली, पण त्यांनी मला 1000 रुपीज दिले, तर हे 750 रुपीज मी तुझ्या समोर तिच्या हातात देतोय. मग ते मला परत येऊन म्हणणे की ती सर तुम्ही मला 750 वापस दिले नाहीत.
Right decision you have taken. Yeah. Dr. Vinod, you had something to say.
अजून एक सर, वन मोर.
सांगा ना.
सर, हे मेडिकल रिप्रेझेंटेटिव्ह येतात ना सर, एमआर लोक येतात, एमआर लोक. मी काढू देत नाही सर.
युअर साऊंड इज प्रॉब्लेम. येस.
हॅलो.
बोला.
सर ऐकू येतं सर?
आता ऐकू येतं.
एमआर लोक येतात ना विजिटला. हॅलो.
बोला.
हिंदी चलेगा बराबर के इंग्लिश?
एक मिनट डॉक्टर संजय. बोलिए डॉक्टर संजय.
सर हिंदी बोलो. सर मैं क्या करता हूँ, जो कोई भी एमआर जब आता है ना विजिट के लिए, तो मैं उनको लैपटॉप या टैब मैं अलाउ नहीं करता. मैं स्ट्रिक्टली बैन कर दिया मैंने लैपटॉप टैब ओपन नहीं करने का.
अच्छा.
सर क्या कधी काय असतं सर की काही प्रायव्हेट पर्सनल गोष्टी होतात आपल्या. तर
हा.
असं मी कुठेतरी वाचलंय की ते लोक रेकॉर्डिंग करतात टॅब मध्ये.
Oh. Yes. Right. Good decision. Yes, Dr.
त्याच्यामुळे
Vinod. Yeah, Dr. Vinod, you wanted
यस
to
सर.
say? Yeah.
हाँ सर, अभी सबसे
Today's
एक तो
experience.
अच्छी
आज
नहीं,
का
एक
आप
वो सर,
हाँ बोलिए.
सर इट वाज एन वेरी इंटरेस्टिंग incident which took place before 20 years. One of my patient, he had an gonorrhea के साथ आया था, सिफिलिस था शायद, तो मेरे को चलो पेनिड्यूरा एल 12 तब देते थे. टेस्ट डोज किया, इंजेक्शन दिया. अभी मैं आइडेंटिटी नहीं, सन साधु बोलते टाइप का, इंजेक्शन देने के बाद बाहर आया. आई आस्क फॉर 20 रुपीज फीस. डॉक्टर साहब सुनो, जैसे 20 रुपीज मांग रहे हैं. डॉक्टर साहब आप कितनी गलत बात करते हैं, मेरे को क्या हुआ? क्या आपने इंजेक्शन मुझे कहाँ दिया है? यू प्रूव के यू गिवन मी इंजेक्शन.
My goodness. Oh my God.
ओ मेरे को अभी तो 500 पेशेंट बैठे थे, उसमें एक बॉक्सर था मेरे एरिया का. उनको पकड़ा के भाई आप कुछ भी ये पैसा देते हैं कि ऊपर के फेंक दो. एनी हाउ एक चीज ये हो गई सर. दूसरी एक जगह पे विजिट पे पहुंचा था. दिस इज जस्ट आई एम शेयरिंग द एक्सपीरियंस. वो लोग कार में ले गए, जैसा बांधना बंद किया, पेशेंट एक्सपर्ट है, डॉक्टर साहब डेथ सर्टिफिकेट अभी न अभी दे दो. मेरे को भाई आई एम नॉट योर फैमिली डॉक्टर, मैंने आपको, आप देते हैं कि नहीं देते? तो दिमाग में जैसे मैंने बताया कि वो सर्टिफिकेट तो मेरा मेरे को क्लिनिक पे रहता है, मेरे पास तो विजिट बैग ही है. मैं सर विजिट बैग में सर्टिफिकेट लगता है, ब्लैंक स्टैम्प. तो उनके चलो वापिस क्लिनिक पे आने के बाद मैंने बोल दिया कि नहीं भाई मैं आपको नहीं दे सकता हूँ. आज ही साहब एक शाम को ऐसा हुआ, पेशेंट आया, 2 दिन से दवा ले जाता था, इंजेक्शन मेडिसिन दिया, देने के बाद उन्होंने बोला साहब एक भी पैसा जेब में नहीं है. तो भी क्या करें, इंजेक्शन तो दे दिया, मेडिसिन दे दिया. कभी कभी मेरे कंपाउंडर बोल देते कि भाई 2 भाग ले जाओ. मैं से ना सब 3 खुराक ऐसे देता हूँ जीपी में. आई एम डिस्पेंसिंग फ्रॉम माय क्लिनिक. इंजेक्शन एंड मेडिसिन दोनों मेरे वहां से देता हूँ. तो कभी हम बोलते हैं कि भाई 2 खुराक ले जाऊं, नहीं तो 1 खुराक ले जाऊं, बाकी का पैसा लेके जाऊं. आज बोला कि चलो भाई तो 2 दिन से आता है, हर चीज आप पहले भी बता सकते थे. एक दिन सुबह सुबह में सब 4 आदमी आया, विंटर था, ओपीडी नहीं थी. इंजेक्शन लेने के लिए मैं क्या आके शूज निकालता हूँ, चप्पल पहनता हूँ. तो चप्पल पहनी, शूज को एक बाजू रखा, इंजेक्शन के लिए पेशेंट को अंदर ले गया डॉक्टर रूम में, अपने केबिन में. वो बाहर आया, फिर मैं तो भूल गए, लोग चले गए. फिर 12:30 बजे मेरी एक विजिट आई, तो शूज ही नहीं मिले, बहुत ढूंढा. तो शूज कहाँ गए थे, लोग चोरी करके चले गए थे.
अरे वाह.
नहीं, चीटिंग के केस तो सब आपने बोले ने कि इतने लोग चोरी करते हैं, सैंपल की दवाइयां ले जाते हैं, ये सब तो होता रहता है. बिल देने की बात आती है सबसे ज्यादा. ट्रीटमेंट करते हैं तो हम भगवान लिखते हैं, जब बिल देने की बात आती है तो हम दानव बन जाते हैं. देव में से दानव कन्वर्ट होते. सब आपका मेरे वहाँ काफी पेशेंट की नोट चलती है, तो हम सब साल के, अभी दिवाली पे मैं बिल लूंगा, ऐसा मेरा 50-60 पेशेंट है. किसी का 30,000 का, किसी का 25,000, 22,000, 10,000, इस तरह चलता रहता है.
Billing
तो
or
उसमें से
how
20
to take the money, you should attend our bargaining patient course, which is starting from this. I have sent you the link. So you register on that page and then you attend from 31st October. That is best for you. And tell your friends also. Today, how did you like the session, Dr. Vinod?
Sir, excellent. Really, it's a learning. After 44 years of practice, really, I feel personally I have to learn a lot from you. You are really very naturally you are speaking ex-tempo. Nothing I think you have prepared. Excellent topic, sir. Excellent topic.
Thank you, sir. Thank you. Dr. Sanjay.
Yes. Sir, my suggestion to all doctors.
Yes.
Don't allow any representative to open their.
Your sound got sound and video.
Hello.
Your sound and video, audio, video got disconnected. You can repeat.
Sir, I could.
No,
am I audible?
Yeah, now you are audible.
Don't allow representative to open their laptop or tab.
Okay. Yes.
Sometimes there are talks of freebies or they give some gifts.
Yes.
Take your photograph.
हाँ.
Gift लिया है, and they can make it viral.
Yes. Once I had same issue. Yeah. Right.
My
I had experience. No, definitely we have to be careful. Once one a representative who was selling the laser, okay, that particular laser dealer was working in a company which was owned by plastic surgeon. And what he started, moment he came inside, he switched on his mobile camera, and he kept it like this so that the camera is facing me. And he started moving inside my clinic. And when he came inside, that time also he, So what I did, I took him along with him. I went outside the clinic, and in the corridor only we were talking. So many things. These things it happens. Yeah, Dr. Fandis, you want to share? Yeah, you can unmute and you can start video. Yeah, Dr. Fandis. Okay, right. Busy in the clinic. Right. So tomorrow again we will be meeting at 9:30, and tomorrow I'll be telling you the whole system of how you can grow your practice. That is what we call it, how to innovate and excel. How to innovate and excel. Okay, that is our workshop which is going to happen from 9:30 onwards. Okay. So do register for that. I'll be sending the link for the YouTube viewers in the YouTube description box. And for all the Zoom members, I already sent the link. So I'm sure you have copied those links and do register on that. And you can send me WhatsApp on my number 98200861112. Okay. I will again send it in the chat box. I have already sent it, but I will again send it 98200861112. Okay, and you can WhatsApp me your name and address and register for all those links which I have already sent you. One is for tomorrow's workshop, which is absolutely free, and second one is for the bargaining patient, how to handle bargaining patient. That workshop and the course is for 5 days, which is going to start from 31st October, Monday, 4:30 to 5:30 p.m., Monday, Tuesday, Wednesday, Thursday, and Friday. Most practical, down to earth, and you will be getting a ready-made script, what to talk with the patient so that you get your deserved charges. Okay, because that's what is the aim of Happy Doctor Foundation. Happy Doctor Foundation aims at doctor should be happy and patient should be happy. Unless and until doctor is not happy, patient cannot be happy. So see you tomorrow at 9:30. Thank you for attending, doctors.